We are going to go over the proper technique in wrapping a leg. So let's begin with the base layer. And the base layer is what we use to put directly over a wound. Now if you don't have a wound that you're addressing, you may not need the base layer. And what we have is we have what's known as a wet proof. There's a number of other products out there that are sold through medical supply houses that are similar to the wet proof. And this is something that goes directly over a wound. And as you can see, this is sterilely packaged so that when we put it on a wound we have something clean. It is a cotton absorbing pad that we would normally apply whatever medication it is once the wound is initially dressed and cleaned. And so we may apply some antibiotic ointment, some salve, whatever the case may be, and we're going to apply this directly over the wound bed if this is where the wound bed is. The next layer is the cling gauze, and this is only essential if you're putting on a bandage to support a wound. And a cling gauze or conform bandage is a bandage that conforms to the limb and actually helps keep this in place while you're putting on the padded layer. Once this is applied, then this goes on, and this is very important. This layer is very important as far as the padding layer. This will help prevent you from creating a tourniquet inadvertently with the third layer, which is the problem most people have when we have an issue with wrapping limbs. It's because the third layer is applied too tightly. This layer here prevents that from happening, and that's why the padded layer, the middle layer, is so important. And we have a whole array of different options here that are available. Everything as simple as a quilted cotton wrap, which everybody should have in their barn. This is our gold standard. This is a combo wrap. We buy this in big rolls and then we cut them out to specific lengths. And they come in different lengths this way for different size legs. And this is basically cotton with a cotton sheet to keep everything together on it. This is a padded wrap. 3M makes this handy little deal called Gamgee, and here again this comes in different lengths. This is the longer length here. And there's, this is one long roll. There's probably 3 or 4 wraps in here, so you'd have to cut them off individually. And then there's good old-fashioned roll cotton, which can be used as well. And that brings us to the external layer. Here again, if we're going to use the same analogy, and we have a number of different products that are available, and I'm just showing a few. The most basic would be the polo wrap, and the polo wrap works really nice if you're going to apply your cotton, your quilt cotton. The most commonly used external layer that we use is vet wrap. There's a number of other products out there that are similar to vet wrap. Vet wrap happens to be my choice. I think it's a quality product. There's actually no substitute in my mind in the market, even though there's a lot of them out there. And then there's another product called Elasticon that is a self-adhesive bandage. This is it's a lot like an Ace bandage. The difference is it has the adhesive properties on the back side. So I'm going to show you how I apply a leg wrap. So if we have a wound on the dorsal part of the limb, I would apply my absorbent pad over that. Now once this is applied, then I would take my conforming gauze and I would wrap this starting at the top of the limb, or top of the wound, I'm sorry, top of the wound, and going around my bandage, overlapping it completely once, and then as I'm going down my primary layer, I'm going to overlap it by 50%. And that's the key throughout all of this demonstration, is that every wrap overlaps itself by 50%. And so you go down and you can see how this wrap is conforming over this absorbent pad. And then I work my way back up with the same rules, is that I want to overlap 50% the bandage below it. And so I'm going to continue that until the wrap is completely gone and unrolled. Now I'm sure that you could cut it if you had scissors and wanted to do so. That would be fine as well. So that's the first layer. The next layer is the padding layer, and this is the most important layer because it's what prevents excessive amount of compression being applied with your external layer. And with this, we're going to go over our base layer in the same direction that we wrapped the bottom layer, which in this case is with him is counterclockwise. We're going to place it so that the area of injury is in the middle of our bandage. going to wrap it around the leg. As such. This is brown gauze, and brown gauze is not elastic, unlike the conform bandage that we just used to put over our absorbent pad. Place it over the bandage with about 1.5 inches of bandage showing above it, and I'm going around the leg, and the first layer is going to roughly come across 100%, and now I'm going to follow that 50% rule as I go down the limb. Now the key is trying to get consistent tension all the way down, and this is how that's done. Is you pull on your external wrap and keep the tension constant as you bring it across the limb, and then you bring it out like here, and you perform the same thing, overlapping the bandage above it 50%. So I'm going to pull it out, keeping it at constant tension, and wrap it around the leg, just like that. I'm going to pull it back out, overlap the bandage above it 50%, constant tension, pull it around. And I'm going to continue that process all the way down the limb. I'm incorporating the fetlock joint on this patient. And then when I get to the bottom, I'm going to leave about 1 inch to 2 inches of bandage or padding below it. And I'm going to work my way back up the limb, following the same rules as I just described. Now, this particular layer is not essential. I like it for wounds. I think it gives us one more barrier to enhance tension and to prevent the wrap from moving down the limb, which is always a challenge when wrapping a horse's legs. And as you can see, I'm following the same rules. 50% now, I'm going down until the whole wrap is gone. Okay. I'm just going to overlay it across my brown gauze. And the same rules apply. I'm going to bring it around. I'm going to pull it out, constant tension, go around the leg 50%. Around the leg 50%. Constant tension. And we're going to incorporate the fetlock. I'm going to go just a little bit further down. Up the leg. So with the elastic on, I'm going to put this on the bottom and above my vet wrap. It's more expensive than the vet wrap, and so we like to use it sparingly. However, there are situations where I will wrap the whole leg with it. And so I'm just going to bring a wrap around. I'm going to get half of the bandage over the skin and half of it